You've been taking the same anxiety medication for months, maybe years, and it worked. You felt calmer, more in control, like you could finally breathe. But now it's like the medication just stopped. Your anxiety is creeping back in, the racing thoughts, the tightness in your chest, the feeling that you're barely holding it together. And you're wondering, am I broken? Why do I have to live like this? I'm Dr. Air, integrative psychiatrist and lifestyle physician. Let me tell you about Sarah. She's 48, high-performing executive, 2 teenagers at home, aging mother with dementia. She'd been on Lexapro for 3 years and it worked quite well until it didn't. She came to my office anxious, exhausted, and frustrated. In her words, I feel like I'm back at square one. Did my brain just adapt? Yes and no. Here's what's actually happening. When you first start an anxiety medication, it changes the chemistry in your brain. SSRIs like Lexapro or Zoloft increase serotonin levels. SNRIs like Effexor and Cymbalta increase norepinephrine in addition to serotonin. Benzodiazepines like Xanax act on GABA. But here's the thing most women don't realize. Your brain is constantly adapting. It's like turning up the volume on a radio. At first, it sounds louder, but over time your ears adjust somewhat and it doesn't feel as loud. Your brain does the same thing with some medications. It's called tolerance. This means your body gets used to the medicine over time, so the same dose no longer works as well as it used to. You may need more of it to get the same effect, but that's only part of the story. For women over 40, there's something else happening beneath the surface. Your hormones are shifting. Estrogen, which helps regulate serotonin, dopamine, and GABA, is fluctuating wildly during perimenopause. One day, your estrogen is high. Next, it crashes. And when estrogen drops, so does your brain's ability to use serotonin like it used to. So even though you're taking the same dose of medication, your brain chemistry is changing underneath. It's like trying to water a garden during a drought. The hose is working, but the soil has changed, so you may need to water it more or differently. A study found that hormonal fluctuations during perimenopause can impact how women respond to antidepressants. But there's more. Your stress load matters too. When Sarah first started Lexapro, her life was stressful but manageable. Now, her daughter's struggling with anxiety. Her mother's care needs are escalating. Her marriage is strained. She was recently promoted at work and has been struggling with the new responsibility of managing a team. Chronic stress floods your system with cortisol, which disrupts your nervous system and increases inflammation in your brain. No medication can outrun a nervous system stuck in survival mode. Therefore, when your meds stop working, it's not just about the medication. It's about what's changed in your body, your hormones, and your life. And that's actually good news in a sense, because it means there's more you can do. So what do you do? First, talk to your doctor about adjusting your dose or switching medications. Sometimes a small increase works. Sometimes a different class of medication is needed. But here's what else matters. 1. Support your hormones. If you're in perimenopause, consider discussing hormone replacement therapy with your doctor. Balancing estrogen may restore your brain's ability to respond to medication. 2. Address inflammation. Omega-3s, vitamin D, and an anti-inflammatory diet can reduce brain inflammation that blocks medication effectiveness. 3. Stabilize your nervous system. Medication works better when your stress response isn't constantly activated. Deep breathing, movement, and sleep hygiene aren't optional. They're essential. 4. Check your gut. Your gut produces 90% of your serotonin. Poor gut health can lead to what's commonly called leaky gut. This causes toxins to leak into your bloodstream and eventually into your brain. Sarah didn't just increase her Lexapro. She started hormone therapy. She added omega-3s and magnesium. She began working every morning. Within weeks, she felt like herself again. Not because the medication was magic, but because we addressed other ongoing issues. If you're wondering whether hormone changes are affecting your mental health, watch this next video where I talk about bioidentical hormone therapy and the new changes made by the FDA.